I think that that is really because we're decreasing the barriers to accessing mental health care by placing a team of behavioral health clinicians or professionals that can support the OBGYN. We're really able to put the access to mental health care where women are already receiving care. I think the one other aspect that I think was really powerful engagement metric was that I think, oftentimes when we recognize that women are struggling with a mood or an anxiety disorder during pregnancy, women are already trying to take the best care they can of themselves and their babies. And that's already there. I think oftentimes what happens is there's so many barriers to access and maybe not a clear understanding of what it means. Sometimes I think mental health care can feel very scary and overwhelming. They may not know what that means. Is it going to be therapy? Is it going to be talking to a strange person? Is it going to be receiving a medication? What is it going to look like? And so to be able to really break down those barriers and to have this type of mental health care be really something that their OBGYN, the doctor whom they trust, for all of their other pregnancy needs, that is really powerful. And I think that really contributes to the high rates of engagement that we saw. It was incredibly meaningful from a clinical perspective. The fact that we continue to see rates of anxiety and depression significantly decrease throughout the study indicated that the model of care, perinatal collaborative care, was incredibly effective at treating moms with perinatal mood and anxiety disorders. As like you mentioned, I think, they patients were receiving this treatment either with a perinatal coach or with a therapist in the course of this evaluation, this analysis. And what we saw is that a significant number of individuals, 30% of patients experienced anxiety symptom remission in an average of about 3 months, and 31% experienced depression symptom remission in a mean time of about 3.5 months. And so I think the other thing to note here is that they received symptom reduction or they experienced symptom reduction from a depression or anxiety, not only in a pretty quick time period of about 3.5 months, it only took about 8 or 9 sessions. And that really shows us that even these brief can be incredibly effective in reducing depressive and anxiety symptoms.